I'm Dr. Mike Milligan. We are here at the California Dental Association meetings in Anaheim, so it is loud, but you really need to hear this. This is very important. This is critical. And I'm very pleased to have Wayne Reese of VelScope with me here. Wayne, thanks so much for being with us.
Thank you very much, Dr. Milligan.
You bet. Now, Wayne, why don't you tell us a little bit about VelScope and where it's been and where it is now and what's coming and why we need this in our practices.
I would love to. I guess the primary thing we're trying to get across to people is we'd like to find disease early. It's 80 to 90% curable. So with or without the VelScope, we really want to get people looking into the oral cavity, doing a complete screening.
Right.
But the VelScope, what it does is help you find that disease early, before it breaches the surface.
Now, how does it do that?
What it does is it uses fluorescence. It shines a light down into the stroma, excites the tissue, gives up energy when healthy, and when not healthy, what happens is you get a very dark area. So it finds...
Different energy comes back at you.
That's right.
Machine.
And it's a discovery machine.
Discover it early so that it can be treated early and the morbidity will be much better.
Absolutely.
Now, and I just had an exam done on myself. It was really simple, very easy. Why don't you show us how you do an exam here?
Certainly.
And a typical exam is going to be about a minute and a half or less.
With the VelScope, you would do your standard palpation, standard white light exam, then you would use the VelScope as an adjunct. So we're just going to jump right to the adjunct part.
I'll stick my tongue out, you can do my tongue. How's that?
That would be just great. So I simply look through the scope, and what I'm doing is I'm looking for areas of concern. Okay? Again, nice, quick, full tour of the mouth. That's all you'd be doing.
Great, okay. So it's easy to use, it's quick to use. Now let's talk about, and it's a wonderful service for the patient that is well documented now, and better than what we've been able to offer in the past with either just our visual exam or some of the other systems that have been out there.
Yes, I think what it does is it lets the patient know they're healthy. What amazed me is also a lot of the patients now show up for their hygiene visits. They want to be scoped. They want to make sure that they're healthy. And given all the new factors, HPV virus, so our traditional risk factors of smokers, drinkers, males over the age of 40, of course that's a risk factor, but also the new risk factor is the HPV virus. So we need to be screening all of our patients.
Right. Is there anything else now that you'd like to tell us, Wayne, while we're, that you'd like to tell our audience for the video?
Well, we are going to be doing something a little bit unique. We're going to be doing basically a registry in the entire dental market. We're going to be providing equipment, but it's going to be arm's length. We're just going to be providing the scopes, and we're going to do a study which what we're hoping will prove is the fact that there is more disease out there in our population than we really realize.
Absolutely. That was interesting, the study that you're... do you want to tell us a little bit about that, or can't tell us yet?
Can't quite tell us yet.
Okay, but a study to tell us, you know, the amount of disease that is out there that's being missed at this time.
Yeah.
And when that comes out, that's going to be really big.
And we're getting that from our user base, and if we extrapolate that throughout dentistry, and there's a lot of other disease besides pre-malignant and malignant disease that we need to be aware of.
Okay, Wayne. Well, Wayne, thank you so much. We really appreciate you being with us.
Thank you very much, Dr. Milligan.
Okay, great.